Healthcare in many parts of Africa would not be possible without the help of volunteers. Local people with only basic medical training are providing essential care and support across the continent, often with little to no pay. DW's Felix Moringa looks at the impact these volunteers are having on communities in rural Kenya.
This is a local ambulance in Katilu, Turkana County. Driving it can be difficult. The terrain is tricky and the equipment is not state-of-the-art. But for Mark Epeyon, a community health volunteer, it is worth the effort.
I feel good because of the work that I do. The women I have referred to the hospital and their kids are in good health without any issues. When I see kids in my community enjoying good health, it makes me happy, and I feel that the work I do is good, as it helps my immediate community.
In a village with no public transport, Epeyon's experience with a bike is invaluable. He works as a motorcycle taxi driver.
Sometimes you're called out in the middle of the night for a rescue. Security is a huge problem in our area. You could easily run into thugs who go around at night. You're forced to wake up since you can't continue sleeping while a patient is in pain and in need of urgent medical care.
He brings people to the clinic for checkups or treatment when he can't help them himself. Community health volunteers have training in basic medical care and public health.
When they come to our home, they ask us to sweep the compound. They bring us medicine. They tell us to purify water from the river by installing purifiers so that the water is clean and we can drink it.
Epeyon encouraged villagers here to dig a latrine. It should result in fewer people defecating in the open, reducing the chances of children getting infectious diseases.
We want to make this a good place by digging some latrines and cleaning them, so that when the doctor comes to assess it, he finds it's clean, so that even when we have visitors, we feel no shame.
Community health volunteers are instrumental for increasing health literacy and promoting healthy behaviors within their localities. Here in Kenya, there are about 100,000 of them who have to navigate everyday difficulties to deliver healthcare at the village level. For those managing health, community health volunteers getting people to the clinic is a big benefit.
They really assist us so much. Number one, they do referrals of clients to the facility. Two, also, we use them in order to pass information to clients or patients once they leave the facility here. Then thirdly, they do what is called preventive health, where now they advise the community on healthy living. They even advise the community on when to seek health care. So it is very, very critical in achieving especially the universal health coverage that we are all geared towards as a facility.
Epeyon says he can see positive changes in his community for the future.
You have to work for this generation so that later they'll come and work for the community. That's what I think about most. I don't volunteer for money or any other reasons, just so that our community members will be able to enjoy good health in the long term.
Community health volunteers like Epeyon are the hidden backbone of healthcare in rural Kenya and further across Africa.